Hey guys, ECRG here, back with another episode. Today's episode is about why clinical research coordinators, or study coordinators as they're often called, should be available, or as available as possible, during monitoring visits with their monitor. And the reason why I wanted to make this video and really make more study coordinator videos in the future from a monitor's perspective is because a lot of people have been emailing me at eliteclinicalgroup@gmail.com about becoming clinical research coordinators or interested in study coordinator as a career path because they want to be a CRA, or maybe they just want to be a study coordinator because they're a nurse and they want to get into research now, whatever the reason might be. So I wanted to make a video about study coordinator and some of the ins and outs of what monitors like about certain study coordinators and don't like. So this is one of those episodes. So a lot of times study coordinators are really, really busy, and that's fine. Sometimes they're on a lot of studies at one time, 6, 7, 8, and they don't really have a lot of time. But one of the things that they should always do is make sure they have a good amount of time when their monitor is on site. And that's because a monitor is there to find discrepancies and to issue queries and find discrepancies in the data and things of that nature. So a lot of times when the study coordinator is there and willing to work with the monitor, they're able to resolve those things right there, and they don't become an action item for later. So one of the things monitors hate is more work, obviously, more paperwork and more, making their reports longer, etc. So everything we do not resolve right there on site has to go on the report. Sometimes you got to write it in the report body and then make an additional action item on top of it. And of course, we don't want to do that extra work. So that's why we like resolving stuff with you there on site. But not only that, it makes your work a lot easier too as a study coordinator, because then you don't have to remember weeks later when you're probably finding the query or going to address the query. You don't have to remember what the monitor said to do, or you don't have to remember, what to input into Rave or anything like that. It's already there and it's already completed. So a lot of times when you're available for the monitoring visit, you should consider that you are working on this study at that time if possible. Now I know it's a lot easier said than done, because a lot of times, you're busy dealing with patients, getting phone calls about other studies and having to do other stuff. But for those coordinators that are able to block off that time and really work with your monitor while they're there, that is really, really helpful and really, really beneficial. And you should continue to do that, because there's nothing a monitor hates more than having to write a cajillion action items because the study coordinator isn't there to resolve something simple. Even something simple as printing out an updated CV or, printing out an IRB form or something like that. That has to be an action item if the monitor uncovers it and it is not completed at that visit. So that has to go as an action item in their report. And those are annoying. And of course, if there's a lot of those things, there's going to be a lot of action items. And that just really makes it longer to review, makes it longer for the CTL to review, makes it longer for it to be approved. And it's just a big hassle. So that's one of the things that monitors really like, when study coordinators are available so they can resolve issues, resolve queries, and just overall get things done. Another thing they like is when you have prepared for the monitoring visit beforehand. So you've become available by preparing for the visit. So maybe the couple days beforehand, maybe you've entered some patient data, maybe you've input some documents into the ISF binder, maybe you've checked to make sure people's CVs are within expiry dates. Maybe you've thrown away lab kits. Maybe you've ordered new lab kits. Things like that the monitor is going to ask you about during your monitoring visit. So that's part of the availability too, is making sure you've prepared a little bit before the visit. Now, a lot of study coordinators do not have time to prepare beforehand, and that's really fine as long as you're available during the monitoring visit to do things. Now, I've had a full range of coordinators. I've had coordinators that have had no time to talk with your monitor during the visit. They just give you the ISF binders and the source documents and say, go at it. And then I've had other monitors that will literally sit with you the entire time during the monitoring visit. And I would definitely prefer if they were to sit with me the entire visit, because then we can work together on things and get issues closed out faster, get queries handled a lot faster, and things of that nature. So that's pretty much what I wanted to say about this topic. Is if you're a study coordinator or new to being a study coordinator and you don't know how to act during your monitoring visit with your monitor, definitely err on the side of being available. You don't have to sit with them the entire time, but you definitely want to make sure that you check in on them pretty frequently throughout the day, because they're going to be finding things, and a lot of times monitors will use sticky notes. So they're going to go over these sticky notes with you, and then you'll have the time to resolve them and get it straightened out so that they don't become prolonged issues and prolonged action items at a later time. So I hope this was informative. Email me, eliteclinicalgroup@gmail.com, if you have any other further questions. If you're interested in resume review or interview preparation because you want to be a study coordinator or a monitor also, you can email me there too. Take care, guys.